So Michael, how does QI fit within the Changing Lives strategy?
So it sort of underpins the whole process of a changing life strategy in many respects. So it's the central pillar to it all in terms of giving staff the ability to change and improve the quality of life for all our service users. And it's giving people a methodology that they can then take away and improve the care and the outcomes for our service users.
Can you tell me a bit more about staff engagement and how QI has facilitated staff engagement?
So QI is going to be used, I guess, in a couple of ways on that. One is about its underpinning the whole staff engagement strategy, and it's going through a QI process. So we're trying to use QI as a methodology for delivering the staff engagement strategy, but secondarily, QI at its heart is all about giving staff the ability to actually control what they do and engaging them in actually managing and delivering the care that they want to deliver. And so giving people the tools to go away and actually improve their work, rather than it being very much command controlled and centrally controlled. We're trying to get it to a point that actually everyone is involved in the design and delivery of the care that we deliver, and that actually we're encouraging people to come forward with their good ideas and wanting to see those good ideas, see those taken into action and see the improved outcomes from that. And if we're seeing good ideas, we need to be taking that into and spreading it across the whole organisation as well, so people can start to see, I would hope, over time that actually what it'll enable is that everyone is coming up with ideas of improvement. Everyone is coming up with how we can deliver better outcomes for our patients, both patients and staff in this, but that actually those ideas that work are then taken across the organisation, so people feel that they can feel that actually what we're doing is actually encouraging everyone to participate in how we deliver services. I think the other bit within QI is very much about giving people back ownership of how they deliver and design their services themselves, so giving people back data. So quite often we've robbed staff of the data about how they're working, and QI is all about getting that data back down to the clinical workforce and the staff being able to see how they're doing, so in order to help to improve the outcomes as well. So actually QI at its heart is all about staff engagement. It's all about empowering our staff and empowering every member of staff to help them to improve care. So I think it's not just about clinical workforce, it's about all staff, whatever work you're involved in, because it is all about every person, I guess, delivering care within or delivering their work within the organisation is doing that for patient outcomes and improving patient outcomes, whether you're a porter, whether you're a cleaner, whether you're the actual nurse at the ward. You're all delivering care, and the QI work is there to help improve that work. We've got examples of reductions in clinical waste that have been hugely important in terms of improving efficiency and so on over in Lewisham, through to the sort of 100-odd projects we have improving the care pathways over in adult mental health, and that you can't separate out whether you're working at the clinical coalface and working patient-facing, or whether you're sitting in a room doing the IT or the administration about appointment processes. Those are just as important as seeing the patient. And we have to make it really clear that QI is about everything. It isn't just about what I do as a doctor, it is also about what the back office staff are doing in order to make everyone else's job easier, which will improve outcomes for the patients, and that's what we're trying to get to. I guess another aspect that's absolutely vital within the QI programme is about the co-production element of the need to do all of QI in partnership with service users and carers, that every bit of what we're doing has to be done in partnership. And in terms of trying to do that when we're thinking about QI projects, we have to involve the patients. What we want to get to is that the outcomes we're trying to achieve from QI aren't the outcomes that I set or as a doctor or any other clinician sets, but the outcomes that are meaningful to our patients. And so they have to be integral in the quality improvement work that we do. If we're going to change people's lives through the work we're doing, the only way we can do that is make the service users and carers absolutely part of what we do in terms of improvements, and they have to be the ones who are setting the aims for everything we do and holding us to account in terms of the work we do, but also involved in the redesign work to improve the care that we deliver. And that's service users and carers, but it also goes beyond our own system in terms of SLAM into GP practices, of getting GPs involved in it. And we're opening up the QI training at the moment to general practitioners from local areas, so Lambeth and Southwark are getting involved, but other partners who are involved, so social care, other third sector partners as well that we're wanting to get involved in quality improvement, with whom we link with, because if we're going to improve the care for our patients that we serve, it isn't just about what we do, it's also about how we link with all the other services externally and how we can help them to improve as well, because they've got issues that they want us to solve and we need to help and work with them to solve those.